Now, this is a guest lecture session, and the chairpersons of this session is Professor Jyotirmoy Pal, Professor P Mukherjee, Parthopratim Mukherjee. The speaker is none other than Dr. Mangesh Tiwaskar. He is a MD, FRCP, and FSCP in the diploma in diabetology from Denmark. He is a consultant physician and diabetologist, Silpa Medical Research Center, Mumbai. He is a gold medalist in medicine, honorary general secretary, National API, and editor-in-chief elect for JAPI, on editorial board of Medicine Update, International Journal of Diabetes, guest editor of World Journal of Anemia. He has delivered more than 1,000 lectures at national and international conferences, and he has many publications, 64 publications in various national and international peer-reviewed journals, has multiple chapters, write-ups in textbooks and update books. Is an examiner, MRCP examiner for Royal College of Physicians, UK. So may I invite the chairpersons of this session, Professor Pal and Professor P Mukherjee, to start the session.
Without wasting time, as because the speaker has been introduced already, we can go straight away to our session. May I invite Dr. Mangesh Tiwaskar to give his deliberation.
Thank you, Chairman Sir, for those kind words of introduction. And I am Dr. Mangesh Tiwaskar, and I will be speaking to you about the telemedicine guidelines and an API's initiative. So before I do that, I would also like to express my thanks, my gratitude to entire West Bengal API team, especially Dr. Jyotirmoy Pal, Dr. Karmakar, Dr. Shivendu Ghosh, and of course, the entire team West Bengal Epicon for this wonderful opportunity. And I'll be talking to you in brief about the telemedicine guidelines and the API's initiative to actually deploy the telemedication guidelines in the healthcare providers of India. So what we looked at, I'll try and brief you on that. So let us accept the current reality. We all know that the entire outlook about the telemedication and the teleconsultation has changed. Now we are in a completely different world, and the future of telemedication has globally changed, especially after the post-COVID scenario that we are all in. And once we are aware that it has got an impact on the various virtual as well as the telemedication consult, given the government of India, including the Ministry of Family and Family Welfare and Health, they have taken an initiative to issue the telemedication guidelines. So what were the aims on which the telemedicine and virtual consult guidelines were issued? The aim was to provide quality healthcare services all over India, and also a quest to facilitate the access of healthcare to the most privileged and underprivileged population, especially those populations who were not able to really reach or were deprived of a quality healthcare. Not only that, telemedication has been also one of the forefront runners in providing the faster, cheaper, and better telecommunication for the treatment, and of course, easier follow-up with experts. By telemedicine and the electronic medical record stores, we can easily store the record for years together, and that will also help to break down those geological and the geographical barriers to the healthcare providers, especially in reaching the inaccessible or very distant areas which cannot be easily connected by a regular consulting, and the patient had trouble in reaching the healthcare. Now, if you really look at the telemedicine reality in India, we all know that WHO recommends doctor-patient population ratio to be 1 to at least 1,000 people. So that means that there has to be one healthcare provider or one specialized doctor per 1,000 population. But unfortunately, the current scenario in India is around 0.62 doctors per 1,000 population. And we all are aware that training of the physicians is a huge time constraining and consuming job, and it's very expensive. So the ratio between the doctor and the patient population is not going to improve for a long period of time. And this deficit can be effectively reduced by effective telemedication services. And this is what we call it as deployment of the telehealth. So what are the factors and what are the parts of telehealth? You'll realize that telehealth is divided into three different aspects: telemonitoring, teleeducation, and telemedicine. And also in telemedicine, we have teleconsultation, telediagnosis, and teletreatment. And of course, teleeducation will also have teleadministration and telebusiness. Telemonitoring will also have telenursing and teleallied care. I'm not going to dwell into that. I'm going to speak on telemedicine guidelines and API is concerned. So telemedicine is healing from distance. And what is the WHO's take on telemedicine is the delivery of healthcare services where distance is a critical factor which is eased out. And it is practiced by all the healthcare providers using information and communication technologies. And this is for the exchange of valid information on diagnosis, treatment, and prevention of diseases and injury, research and evaluation, and most importantly, communication in between the two healthcare providers in the interest of advancing health to the patient and the community. That is the WHO's take. And that's why, virtual consulting has come up, which is a process of getting a medical opinion without specialist visit in person. And that also allows a platform to a physician to interact with other physician colleague or other specialty or a super specialty or a subspecialty colleague on the various electronic medical record backgrounds. There are 5 basic types of telemedicine you all understand. One is according to the timing of the information transmitted. Now that has 3 subgroups, like real time or synchronized telemedicine, what we know, when the doctor and the recipient both are online at the same time and they share the live transfer of information. Store and forward or asynchronized telemedication, where the patient can transfer the data on the particular site at his or her convenience, and a healthcare provider can view and review and comment and suggest depending on his or her convenience at the different times. And of course, the third and the most important aspect, which is now slowly growing up in most of the fields of medicine, is the remote monitoring. And as the technology in the monitoring is bettering, we are getting better and better monitoring devices as well for this telemedicine application. And the second part is according to the interaction between the individuals. So it can be an interaction between the healthcare providers, or it can be an interaction between the healthcare professional as well as the patient, where the data, the information can be transferred easily. There are different types of telemedicines. What are those? Teleconsultation. It can be on chat mode. It can be on social media. We are all used to it now, especially WhatsApp, Telegram, SMS, emails, Facebook, Instagram, Snapchat, and so many things are available. And of course, there are some private and video consult organizations which have given up or provided a platform for a video consultation, a direct video consultation through a private service providers. And a proper full-fledged telemedicine using an approved EMR is the need of the hour, and we need to practice that. So these are all the various areas where telemedicine tools and services can be beautifully interacted between the clinician to clinician, clinician to the patient, and clinician and the technology. And that is what the advantages of the telemedicine. Now, what are the different applications which can be easily addressed? We have already discussed telehealthcare, telehome healthcare, and the specialty consult and the diagnostic device. And also, as we are discussing now, we are connecting. I am virtually sitting in Mumbai, but I am interacting with everybody in India and especially the West Bengal people through teleeducation and teleconferencing. There also, teleeducation is being bestowed by schools, especially during the lockdown periods. So we all know the advantages of these tele services or telecommunication services that we are practicing. At the community level, telemedicine can be beautifully used for the screening of the diseases and disaster management. Now, who can practice telemedicine? Of course, all the registered practitioner registered under IMC Act 1956 can provide telemedicine consultation, but only after they qualify for the prerequisites. And most importantly, now what are those prerequisites are? The National Medical Council and the Medical Council of India are in process of developing an online telemedication courses for ensuring the uniformity across all the specialties in India. And once this course is developed, it will be mandatory for all the registered medical practitioners to undertake this course within the 3 years of the notification. And this is what the Board of Governors in the supervision of Medical Council of India have issued this GR. And thereafter, it will be compulsory for all the registered medical practitioners who wish to consult, in the telecommunication format, have to undergo this course mandatorily. And on date, all the registered medical practitioners can teleconsult, provided they follow the telemedication practice guidelines notified under IMC of 1956 that I have already told. What are the pros and cons of this telemedicine? You all are aware. The pros we have discussed in details, that it is a genuine time saver for the patient and the caregiver, gives access to the quality healthcare services from the remotest possible areas, and especially with those who have got mobility challenges or issues. And it also has helped to break down those geographical barriers. So people from anywhere can consult any healthcare specialist in the world, and provides an opportunity to reduce down the healthcare economic burden. That is the most important thing. And the other biggest advantage which has come up is that with this telemedicine platform, now the specialist interaction has also improved, or probably is better. So overall, if you see, telemedicine has got a potential to provide better healthcare services to masses. That is the most important thing. But of course, as there are upsides of the story, there are a few downsides which we need to be very, very careful. The infrastructure and the technical training which is needed, it's still developing, but of course the younger generation is adopting it very, very fast. Remember that as the telemedicine becomes a part of your day-to-day practice, the direct communication between the patient and the doctor virtually is robbed off. And remember that to make a complete diagnosis, we all understand that physical examination or touching the patient is extremely important. There could be a lack of standardized format currently. Slowly the things will start becoming standardized overall, but currently there is also a lack of standardization in the format between the interaction, and of course the absence of consent form. We do not take the consent forms, or even opting or refusing for the availment of the service should be one of the considerations whenever you are setting the laws for telemedicines. Unfortunately, telemedicine is currently not a part of a medical curriculum training, which will be definitely there. So there are some ambiguous areas which will be slowly clarified as far as the privacy, confidentiality, security of the patient information, the privacy of the treatment. Everything will be clarified. One more challenge that we have is still there is a big ambiguity in between the medicine and the legal, I would say, issues arising out of the telemedicine. But as we advance in our knowledge about telemedicine, slowly, these things are going to better. But for now, telemedicine services in the country are made under the combined jurisdiction of Ministry of Health and Family Welfare and Department of Information Technology. We have to abide by the rules which have been already there on the MOH and the Family Welfare Government of India website, which are already there. Currently, they are applicable to the medical colleges, but also now they are applicable to the private healthcare providers. Medical legal challenges between the patient-doctor relationship, the informed consent, the malpractice, liability, privacy breaches, rights of the patient, and now the insurance companies have to also provide some kind of a backup to provide reimbursement. So this is going to come up slowly. So we are developing the laws for the telemedicine, and we are going to come out with some solid statements from the support from the Indian government. But till that time, probably this area will be still considered as the gray zones in the medicine practice. But most importantly, points to remember are telemedicine is going to keep on evolving, and it will going to keep on constantly changing. So you need to keep yourself updated on the various telecommunication rules, which slowly will keep on evolving. Understand that when a corporate body collects, stores, transfers, or processes any information related to the patient or their families, there are certain requirements which need to be absolutely taken care of under the data protection rules, and this is mandatory by law. And it is also a requirement for the corporate bodies to understand that the privacy policy needs to be in place in their organizations, and they have to be published on their websites. There are a few questions which are always asked whenever I talk about the telemedicine guidelines. And one of the commonest one is that, as being a healthcare provider, am I supposed to keep the screenshots and the records of the patients, especially with whom I consult, telephonically or through the telemedicine? So the answer is yes. It is always better to keep all such kind of records, especially phone logs or the email records or the chat or text records or video interactions. And if you are issuing a digital prescriptions, also please preserve this digital prescription either in the digital or physical format, because they can be needed in future for any such legalities which can come out. What drugs can be prescribed by telemedicine? Of course, there is a guidance which is also there on the website of Ministry of Health and Family Welfare. You can visit that and find out. But especially remember that Schedule H and Schedule X drugs are prohibited from prescription under the Narcotics Cosmetic Act and the Psychotropic Substance Act of Government of India. So remember that we all need to abide by the directions issued by Medical Council of India or National Medical Council and Ministry of Health and Family Welfare. Can prescriptions be given remotely? Yes, of course. That is the reason why telemedicine practice guidelines have been developed, and slowly, everybody will be enabled to practice telemedicine. Also remember that pharmacists can also dispense the medications, provided that they do have got an adequate facility for just not only having the needed permissions, but also for the record keeping purposes, including the various signatures and facsimile of the signatures of the doctors or the healthcare providers. So what is the future of the telemedicine? Actually, future of the telemedicine is very bright. Worldwide, we all have to understand that millions and millions have been benefited by these telemedications and the telehealth guidelines and the approach of various organizations, and it is going to grow up continuously. Remember that patient may not want to return back probably to the before COVID era, but then definitely we would love, as being physicians or the healthcare providers, that the patient goes back to the before COVID scenarios where you were seeing the patients face to face, you were able to physically examine them, and also directly face-to-face interactions made all the differences. But as even Dr. Shashank Joshi says, that life will never be just the same in an AC era, that is after COVID era, as it was in the BC era. There are challenges in the futures as far as the regulations are concerned, the mandate of the telemedication are concerned, and of course, there has to be a clear guidelines, and they have to be issued by the various authorities. The clinics, the hospitals, and the healthcare providing facility must be equipped with all kinds needed, including the internet connections, including the laptops or the various electronic communication medias for deploying this telemedication medication facilities very effectively. And a proper communication and documentation has to be maintained, and there has to be a regular upgrading of not only the data, but also your hardware and software necessary for that. API has also come out with the specialty specific guidelines under the banner of A-Halo in association with Abbott India Limited. Currently, we have got diabetes, cardiology, and thyroid disorder A-Halo telecommunication guidelines, which are available. They are there on the API website. The interested candidates can visit the website and can easily take the advantage of this A-Halo therapy specific telemedication or telecommunication guidelines or teleconsultation guidelines. I would like to also thank Abbott India for being the educational partners for this session, and Association of Physicians of India, along with Abbott India, is on the mission of telemedication, which is, according to us, is a way of natural evolution of the healthcare practice and education in the future e-world. Thank you very much. I would again express my gratitude and thanks to Dr. Jyotirmoy Pal for this beautiful opportunity. And I also wish all of you stay safe, stay happy. God bless you. Thank you.
So we can go to the question answer session. If there is any question from the floor, that can be asked right now.
Hello, am I audible?
Yes, sir.
Hello,
Yes, sir. You are.
hello, hello.
Yes, sir. You are audible.
Yes, to Professor Tiwaskar.
Yes, sir.
Just I want to know one question. Just one question.
Can you unshare?
You see the telemedicine. Yes, the telemedicine part is blood pressure recording and blood sugar recording. I mean, this actually this recording is very difficult. Patients, we used to say to patient party that you should take blood pressure or digital recording. But I think the digital recording is so fallacious now. It's so fluctuating. It is so unpredictable that actually they were misleading. Whatever treatment should be given, blood pressure is raised or not. And diabetic patients, they're saying blood sugar morning is 90, next day 190. So that is actually, I think, this is one of the very disadvantaged part of the telemedicine. So I think, Dr. Mukherjee, you also do agree with this point. Now I will request to say a few words about these fallacies, the recording of the digital blood pressure and your blood sugar monitoring by glucometer. We do find every day this problem is going on with the teleconsultation. Yes, please, Dr. Mangesh.
Thank you, sir. Thank you. Actually, it's a very pertinent point that you have come. But believe me, sir, especially in this COVID era, what we have learned is, okay, fairly fine. Your point is well taken as far as the fallacies of glucometers are concerned or fallacies of blood pressure monitors are concerned. There are genuine challenges and they all require standardization. But I think everyone, including all the stakeholders, including the pharmaceutical companies and the makers of glucometers and blood pressure monitors, they have always really improved their services. And now we do definitely have glucometers which are more accurate, more easy to operate. And now the digital communication directly from device to device, that is from glucometer to glucometer, easily happens. Similarly, as far as the electronic recording of the blood pressure is concerned, if you really see to it that you spend some time with the patient, adequately training him the correct way of measurement of the blood pressure, I am sure that the errors of measurement will go down. Secondly, there are multiple studies which are published saying that, you know, more frequently you use your gadgets, more accuracy is achieved over a period of time. So occasionally, if your patient is measuring, but you must tell your patient and be very frank and free enough to tell the patients that if you really still feel that if this is something incorrect, either seek a close by medical support from your locality, go to your family doctor, check your blood pressure there from him, and then report to me back. Or otherwise, tell them that if there is an error in the glucometer, possibly call a lab guy now. And especially now we have got so much of relaxation of the rules. Now the laboratory people can also visit the patient's house. They can collect, and you can have easily, more reliable report. But as a physician practicing, and especially in the city of Mumbai, what I have experienced during these COVID times, that it has at least given me a beautiful opportunity to communicate with the patients from distance, far away. There is no way that I can say that telemedicine will replace our day-to-day clinical physical consults. There's no chance. There are so many caveats. But in a challenged scenario that we are, probably I think these are probably the better options. And fortunately, our stakeholders are also now becoming more and more committed and more willing for it. And there are even laws which are coming up, supporting it and supporting the medical fraternity. So I think this option should be kept open. But points you have brought are absolutely valid and completely agreeable, sir.
Thank you, sir, very much. Thank you.
I have just a question.
Yes, sir.
Maybe silly, but this is very practical. Sometimes what happens at the odd hours, the patient makes a phone call to us. I mean, we the treating doctors, and once about the medicines. So there was earlier, Supreme Court has told that it should not be given. But now at this moment, what should we practice? If we give medicine over telephone and if it is not taken properly, I mean, if the or WhatsApp, then what will happen?
Yeah. So most importantly, sir, now WhatsApp, as you talked about, now let us not be very specific on one specific social media platform, but there are platforms and there are, the patient management softwares which provide you a choice of even writing down or typing down your prescription and send it with your official digital signature. So that will give you two advantages. Number one is this, that it will become an authentic prescription from your office. Secondly, by using this kind of platforms, you will be able to store your prescriptions as a record for self-keeping, and also patient can generate that prescriptions to the related chemist. My recommendation to you is this, that if you are prescribing somebody on the social media platforms like WhatsApp or something like that, write down or get it typed, take a photograph of it, including your digital signature and a stamp on it. And then probably you may send the details to the patient in a prescription format only, rather than typing on the chat boxes. It is always advisable to, write it down on a proper letterhead, sign it, and then send a photograph of it. That is also sufficient for the patient. And now Supreme Court has now, including the law makers, have now agreed that yes, it is allowed to send the prescriptions. Of course, there are Schedule H and Schedule X drugs which cannot be given, on the telemedication platform, which we'll have to abide to till the time the entire clarification as far as the narcotic laws and the other laws are concerned. But otherwise, the rest of the medications can be easily sent by various electronic platforms. And I would strongly encourage people to start using now the electronic patient management programs in their clinics, their hospitals, which will make the lives very, very easy.
Okay, thank you. If there is any other question from the floor.
Okay.
So we can close the session and we can go to the next session.
Thank you. Thank you very much. And
Thank you. Thank you.
Once again, Dr. Jyoti, Dr. Karmarkar, and everybody, thank you very much for this wonderful opportunity. And Jyoti, it has been always pleasure to see you, even though virtually. I would have loved to be there in Calcutta and have some, a mishti dohi from you, but unfortunately, I had missed that chance. But you need to promise that, next time when we are together, we'll celebrate for sure.
Thank you, Dr. Mangesh.
Or
We'll be
Jol
happy to
Macher,
welcome you in
I
Calcutta.
need to have a Jol Macher also.
Thank you.
I would like to thank the speaker, Dr. Mangesh Tiwaskar, and the chairpersons, Dr. Pal and Dr. Mukherjee, sir.